when they went into that space and they sang together. Even talking, you know, they are, now the physicists are very busy doing experiments. Even when we talk, there's droplets that come out.
Yes.
So when you look at the data of countries where they've said you must use a mask, everybody, homemade mask, not these. These ones we keep for the hospital.
No.
The standard of this mask requires it's used in the hospital. That's what it has maximum value. But when everybody else covers their face, in fact, that's a new language, cover your face, you see that the growth of the epidemic is very different from where we have said it is not necessary to cover the face. So I think there's a need for all of us to participate in this prevention. I keep my droplets, and you keep yours.
Yes.
And in that process, hopefully, we'll reduce the rate of transmission. Yesterday, I saw pictures out of the ferry in Mombasa. Everybody had a mask. They had all sorts of masks, you know, homemade and all that. But I think that that level of protection needs to be put in place. So it's both the training, which I agree with him that we need to train.
Yes.
It is a protection and paying attention to the standard of protection that we're providing to the health worker. But then it's also about we as citizens being accountable.
Yes.
So if you know you have, for example, that person probably had traveled, probably had been exposed, and there are lots of people who've been exposed who are having to be looked for by the public health people. They're not volunteering.
Yes. That's true. Hold the thought. Just a minute, George. The Maendeleo ya Wanawake are having a press briefing right here in Nairobi. Let's first of all listen to that. Okay. It's in regard, of course, to the COVID-19 virus pandemic.
We also want to pass our condolences to the young boy we saw who was buried yesterday, unfortunately, and the other person in Mombasa, while we were all as a country trying to get sorted out as we understand the coronavirus. And the first case, of course, which was announced, who passed on, and any other person who has been aggrieved, we want to pass our condolences as Maendeleo. Now, this morning we want to pass a message, and we've said good morning to all of you. We thank you for making time to be with us this morning. We have called this press conference as the umbrella organization representing women from all corners of Kenya. We have important message to share, especially to the women spread out in the country. And we want to thank you for making it possible for us to use your media this morning. This indeed is a very difficult time for our country and indeed the world, as we are faced by the coronavirus, COVID-19 pandemic. The Ministry of Health has told us that approximately 10,000 Kenyans could potentially be infected by the virus by the end of April. We mark today's first. As a country, we face a grim time with the situation set to get worse. This calls for every one of us to adjust our lifestyles and behaviors accordingly. As the leadership of women in this country, we have a role to play in mitigating the progression of this pandemic. As mothers, we are the custodians of the families and communities. I therefore call on all Maendeleo elected leaders and members and women of Kenya from the wards, sub-counties and counties alike to be at the forefront in observing the social distancing and promoting the hand hygiene as stipulated by the Ministry of Health. I call upon the women of Kenya to go the extra mile to sensitize other members in our communities on these important guidelines. It is incumbent on all of us to protect ourselves and those around us. Women as mothers are the first doctors at home, and it is our time now to make sure high hygiene is maintained. This will go a long way in flattening the curve. To the younger generation, I wish to urge you to take this virus very seriously and know that these are extraordinary times calling for extraordinary adjustments to the lifestyles we are accustomed to. We must change our behaviors and follow the guidelines provided by the government, I especially wish to urge the youth to stay home, kaa nyumbani. We sincerely saw a few days ago youth in Eldoret. It was extremely sad. We even saw some young children, and my personal belief is that those children belong to mothers, those husbands belong to women. It is our responsibility to keep our families home. Maendeleo will use its network of elected leaders and members through all media, including digital and mainstream media, to reach as many people as possible with the aim of passing information on control measures. Further, we will identify the elderly who, for one reason or another, may not be benefiting from the Social Protection Fund and forward those names to our parent Ministry of Public Service and Gender Affairs for intervention. Maendeleo remains committed to supporting and complementing government efforts during this crisis as always. In this regard, I wish to state that as an organization, we will identify our members to be trained as community health volunteers to support in distribution of masks, other protective equipment, and even food supplies if and when such services will be required. I want to say we did this in 1996. Maendeleo was used by provincial administration because we are in every village, and we were able to identify that mzee there whose wife died and has no food, that mama there, so we are ready and willing to do the same to help our government. I wish therefore to support, on behalf of Maendeleo and the women of Kenya, the call by His Excellency the President Uhuru Kenyatta on all of us to adhere to the laid measures and protocols laid down by the Ministry of Health. We are grateful for the targeted interventions the head of state has made to cushion Kenyans from the vagaries of this pandemic. We also wish to appreciate the efforts of the Ministry of Health for the interventions they have made to arrest the situation, and for the constant updates they have continued to share with the country on the progress of the pandemic. The leadership of the Health Cabinet Secretary, Honorable Mutahi Kagwe, has been exemplary. Finally, I call on ourselves to share that extra food we have in our homes with a needy family, either in the villages or in the urban setups. As Kenyan women and our friends, let us commit daily prayers for our families, for our communities, for the President as he goes through this very hard task, and for the nation of Kenya. Lastly, I call on all leaders to support the government's efforts in fighting this pandemic. Together as Kenyans, we can overcome any challenge as we have done in the past. I thank you. Any questions?
That is a live feed from Maendeleo House, where Rehab Mwekali, who is the chair of Maendeleo ya Wanawake here in the country, was giving a press briefing in regard to the coronavirus and some of the things that she has touched on. Of course, we have to adjust our lifestyle. It's not business as usual, calling for people to adhere to the measures being recommended by the government and also by the World Health Organization, sensitizing others to make sure that everybody is in the know when it comes to the virus, and to take the virus very, very seriously. And something interesting is that she has asked members to join in the fight by offering services if so needed, perhaps distribution of things, sanitizers, masks, if need be, and to share the little that we have. Remember, the country is, and even the economy, is at pains at the moment because of this coronavirus. And perhaps, in case you're joining us now, this is News Check, and I'm joined by two medical practitioners. We have Professor Ruth Nduati, who is a pediatrician and also a lecturer at the University of Nairobi. And we have George Gibore, who is the Kenya Union of Clinical Officers General Secretary. Perhaps, Madam, shall we start with what she has just said?
Yes, I think her statement is completely on target as to what we need to do.
Yes.
I want to pick up on two issues. First, how prepared are we? I think no country was prepared for this kind of epidemic, but Kenya is making progress. I think it should be known that the individuals who are manning the centers where people diagnosed with COVID virus are being treated have been trained. They were trained on how to do that. They were actually trained by part of the teams that worked with the Ebola epidemic, and were trained using the materials out of WHO. Two, there are many subcommittees that are actually supporting the Ministry of Health. They have developed guidelines on what to do in the different spaces. Those guidelines are available. And then over the last week or 10 days, there's been a progressive stepwise training or development of the training materials and pre-testing of those materials. And a lot of that work is being done at Kenyatta National Hospital. And I would say that if you go on the website of KNH, you will find the different courses that are being offered, everything from infection prevention, that triaging of patients when they come into the service, how you treat a person who's been diagnosed with this coronavirus, and how do you manage, for example, a mother who has coronavirus and has a newborn, or she's coming and she needs a cesarean section or whatever. You know, that clinical management. So that progress is being made. But having said that, we are not anywhere near achieving the goals that we need to achieve. I'm glad Maendeleo has referred us back to the past and said that previously when we faced other epidemics or we had disruptions, Kenya's success has been from the grassroots, people responding from the grassroots, not waiting for something to happen. And I would say that the grassroots movement has not been limited to the villagers. It has been at many different levels. For example, as we are here now, the team of consultants, the Kenyatta National Hospital has consultant physicians who are both University of Nairobi and Kenyatta National Hospital. We're actually having active fundraising to raise money to be able to buy those masks we talked about, those personal protective equipment. We're not saying that the government is not able to. We're saying that everybody needs to step up. And in fact, that fund is about 700,000 shillings at this point. So there's that kind of an effort. I think that the same is required of all of us in the, particularly as health professionals. We must meet each other.
Somewhere in the middle.
Our challenge is the way our health services are organized. The majority of health workers are employed by county governments, 47 county governments. And only a very small cohort is actually employed centrally by the Ministry of Health or by the National Referral Hospitals. So we need to bridge those structures so that we actually can move forward to be successful. It is not, the sentiments of the clinical officers council are the same sentiments that I've had expressed by the medical practitioners, are the same that the nurses have, but I know that people are stepping up. I think it's important, the stepping up and saying what the problem is an important process of solving the problem. But the bottom line is that every one of us must do what we can do within our space to address this. One more thing, the family, we must stay home. But when we stay home, we must also protect family members. The new infections in countries that have had this disease for a little longer are family clusters. So a member of the family came home and they were infected and they passed it on to the others. So when we say stay home, social distancing, it's not just to do what serikali ilisema. You are actually actively protecting the people you love most, your family members. And when you fail to do that, they are the first one to be in trouble.
And perhaps, George, can you kindly comment on what the chair of Maendeleo Wanawake has just said? And of course, something interesting, asking members, of course, to join in the fight, and if need be, if their services are required, they should avail themselves.
I think that is right, and I want also to comment what the chair of the Maendeleo women has said, and I wish to say that it is right that we have to change our behavior, both socially and how we do our things. And we have to actually demonstrate indeed that we are supporting the government. Indeed, I want to go back, that is the statement that we have been getting from the WHO, which is one of the things that this time we must not wait for the government to do something. It is us to do it. But indeed to do it, the sensitization must be there to tell you that you need to do this, this, and this. As we talk about the IPC, the Infection Prevention Control, it starts with myself as we talk about the hygiene, it starts with myself, then it goes to the environment that I'm in, and then we ensure that also we are able now to affect the other people who live with us. As she has said that, of course, we need, when we are told to we go home, then we have to take care of the people we have at home.
Yes.
Unfortunately, the setup that we are in, it is such a dire one that a majority of the Kenyan cannot stay away from their family member. They are 10 of them in one or two room house. What will you do? How do you do? In any case, actually, that's what we have been asking, that the government need to relook on the health workers more specifically now who are actually at the danger of it all. They will endanger the patient they are serving, they will endanger the people they come across and their family members. The people who are working, we have recommended through a letter that we did to the ministry, the people who are serving in the quarantine center, isolation center, and now more specifically to the region which we have identified to be high risk, they should be provided place to stay away from their home. Actually, we should not have all the health workers serving the same time. We need to separate half of them serve at least 14 days, be tested and be taken through a procedure to understand they are well, then bring the other staff. This is what happened to the facility that I'm talking about. All of them have now been gone to quarantine. The other people, because once this one tested positive, the husband actually has tested positive, they are going for the house help and the children. Now, how you trace now again the patient. All the staff have been taken. The facility was to close down. That has a very significant implication because one, even the patient who have trust on that in that facility might fear tomorrow when they know, oh, kuna corona hapa. They don't trust what you're doing, whether you sprayed or not. They might fail to trust. If indeed the community will understand that some of us, the health worker, have become the agent of spreading the disease, they will shy away from coming to the hospital. And that have a significant implications to the community and the way we run our facilities. And I need to mention something else also, as talked about what the government is doing about training. I think that is very good and very important, but I think it is little for now because of the cases and the multiple cases that we are getting in the country. Now that we are not importing and it is here with us, as I said, we are incubating this disease. The government must not do things from the boardroom, must do things in the field. This is where now the frontline health workers who are actually the soldiers who are supposed to be used must be seen to take charge and be able to do contact tracing. And I want to tell you that by way of follow-up what the WHO have said, what we are doing and calling control tracing, contact tracing is still at 30%. What does that one tell you? It is very dire.
Yes.
So, and of course, I remember when we put the curfew, the president, someone mentioned outside there that we have realized that the disease spread more at night or in the dark. And of course, we have seen also the WHO saying what is happening, the cases we are seeing in Africa might not be the real one because we are not doing the real testing. We need to test people. We are not testing. As you remember the case I mentioned about the patient who went to Mbagadi and was turned away, and only who we are suspecting could be the source of our health workers who was infected. So we are trying to say that the government must now get out of their box and must consider things that we are saying who are practitioners. And of course we have said the government has given relief measures to some of even the people who are over age.
Yes.
They starting from 58 of age, they can be released from work. But it has not been given to the health workers. We have health workers with impending conditions. They should be released. We have health workers who are actually lactating and pregnant. They should be released home. You understand?
Yes.
And of those now age that the president specified. This is what we say now, you are taking the fight where it belongs.
Yes.
We don't have to wait to hear cases of death of healthcare workers. It will actually have a bigger implication also.
Yes.
Remember what is happening in Italy. I have mentioned about that.
And Spain
in
too.
Spain.
Yes.
So it is something that is worrying. But before it worries,
Yes.
we have time and we have the space to ensure that we are taking the right measures.
Thank you. And of course, we have a capacity of 300, testing 300 every day. We're going to look at that, plus the mask and how we should use them, how we should dispose them. We're having a very interesting conversation regarding the coronavirus. But also, we also want to keep a keen eye on the Tenants Association of Kenya. They're actually having a press briefing right now here in the capital, Nairobi. Let's listen in.
in June, then the government, in that package, we're even proposing that the government should actually give them maybe some sort of finances to cushion what they're coming, what they're actually doing to the nation, and of course, helping the common mwananchi. So those are the main points that we're looking at. One, no payments of rent for the next 3 months. Two, for those people who are servicing the loans, they should be given at least 6 months moratorium, so that they don't have to pay for the loan, because it's going to take time before the economy recovers again back to its to normal circumstances. Thank you very much.
Yes, good morning. My name is Kushan Mushiri. I'm the chairman, Matatu and Boda Boda Operators of Kenya Federation. And with me here, I have the BAK chairman, Boda Boda Association of Kenya chairman, Mr. Charles Geshera, the Boda Boda Association of Kenya Secretary General, Kenneth Onyango. And the federation is made up of associations from both the Matatu and Boda Boda associations. So when we are here, we represent those industries, the Matatu and Boda Boda industry. I would like to start by commending the government on the action. It has said that it is bringing sanitizers and masks to us so that we can supply them to the ground. I believe that one will be one of the best strategies, because we are already implementing the 1 meter rule in our buses and in our PSVs. However much we are making nothing, but we are truly trying to fight this pandemic together and hand in hand with the government. However, we are asking that the government makes sure that it involves us in the distribution of these sanitizers and these masks. Otherwise, we don't want a scenario whereby our borders and matatus are being harassed that they are not having those equipments, yet maybe they were given to people we don't know who don't help in reaching them to the ground. Number two, as the Matatu and Boda Boda Operators Federation, we still insist on President Uhuru Kenyatta, please, as you did with other sectors, kindly reduce the levies on fuel by at least 50%, so that we are able to service and take people to their workplaces. Because we are already adhering to the rules of the 1 meter rule, and you are providing the sanitizers and providing the masks. Then why don't you reduce on the fuel, reduce on the insurance premiums, scrap totally the parking fees for the counties, so that we are, as an industry, we don't have to hike fares. This is a win-win situation for everyone. So President Uhuru Kenyatta, we are with you, but you also need to come in and be seen to be doing something to cushion us so that we are able to serve mwananchi. We don't want a case whereby we go on a total lockdown and people don't have food to eat. So I also allowed the tenants and landlords leaders, because of what they are appealing for, because even our conductors, ourselves, even as leaders, we don't know what we pay rent with. So thank you very much, and we look forward to working with government.
Thank you. Good morning everyone. Na mimi mniruhusu niongee kwa Kiswahili kwa sababu nataka kitu ambao itaeleweka. Kwa majina naitwa Samson Wainaina. Mimi ndiye mwenyekiti mkuu wa chama cha kitaifa cha wafanyikazi wa matatu, dereva na conductor na yule managers ambao pale on the ground. Jambo langu la kwanza ni kuishukuru serikali kwa yale mambo ambayo imechukua kuhusiana na hili janga la COVID-19.
It's a group of associations right here in Nairobi, not only for the landlords and tenants association. You've had even for the welfare of even border borders. And something that I have really caught my eye is that they're talking about government should involve us fast before making some decisions. For example, they've talked about the fuel levy being too high, the parking fees, insurance premium, but the government wants borders, and especially the piki one, to make sure that they have complied.
Yeah, I think I need to say that that is now what is happening, because if you want some people to carry out some measures, involve them, because that's the demand of the constitution. And then the next specific thing I need to say, you have seen it, like what was happening in Nandi, people spraying all over. This is measures that are used for control in now cleaning of the environment and ensuring that you're disinfecting. But what happened to the individuals? Like I need to say, I have said like what the first press that we have seen, they are saying about changing of our way of doing things. Like, have we changed what we are doing in our facility, like the health centers specifically, and the public health places? One, we have written to the government and encouraging them that at the entry point, they need to place their water and sanitizers for all the patients to use when they're coming in. We have also provided that they should be provided masks when they're coming in before they just come, because anyone could be an agent. And then we have said any patient with any classical symptom that could be, they should be seen away from other patients. We have patients coming, spending more than 8 hours on the waiting room, and they are mixing with other patients. We are not able to control them, keeping the 1 meter distance.
Yes.
So that is where we need to start from. When we tell people that this should be done medically, with the medics and also the health ministry, what are we doing about where we are able to man? I think that's what people are saying. Involve the people. They have what they can do. Then it will be able to change and take shape. I want to say that I was with one person from the Sierra Leone, who is the WHO leader there, and he's one of ours. He said that, like, the issue we talk about social distancing, for them is not a big thing because they learn from Ebola. Now we are learning about social distancing. And even when this term came, when people were wondering, what is this terminology you are talking about, social distancing? And even me, when I meet Daktari, she's a friend of mine. I almost, because of the feeling, I almost touch, then I retract my hand.
Yes.
You understand?
Yes.
So this is how we are learning, but we are learning in a difficult way. And when we do that, we must take that stringent measure which can be able to assist us. And by that, I've said we need to employ more health workers to buff up what we're having currently in the public sector, considering the frontline health workers, immediately be trained, because that's why we say we need to have a reserve. So that if we have a certain facility affected, like if we have a patient, maybe one of us testing positive in a bigger facility, that's to mean many of us will go for quarantine because we are interacting every day. So if that one happens, should we close the facility? No. We need actually to categorically classify how we are going to utilize these frontline soldiers to offer the services continually, without actually sending a bad signal outside there to the people who want to rely on our health facility to seek services. Yeah. I think that is very good for the government to consider. Yes. The other thing I mentioned about this, when we are changing about that, we the health workers, as we sensitize the community, must sensitize ourselves first, and that is the responsibility of the government to sensitize the health workers.
Professor, please, you can touch on that and the quarantine process. What are the do's, the don'ts, and the mask? You see somebody wearing a mask from morning till evening. What actually should we look for in a mask? And also the quarantine process. What are the do's? What are the don'ts? We just hear people are quarantined. What we know very well is the curfew, because you're supposed to be in your house. But what exactly entails inside a quarantine?
Now, a quarantine is for the person who is possibly exposed. We don't know whether they're infected or not. Either they haven't gone through the whole incubation period, so even if you test them, they may be negative, but they're infected, we need to test them again. Yes. And the ideal quarantine space is somebody to have their own room, their own toilet, their own bathroom, their food is brought to them, they have their own cutlery, their own clothes, they wash themselves, and they use a mask when they are, if they are stepping out. Ideally, they should not be stepping out of the room, or if they're stepping out of the room, they should be masked. Yes. Because we don't know whether they're infected or not. That is quarantine. And you don't want to put lots of people together sharing the same space in quarantine, because among them there might be one who's infected. So then that becomes a sort of an environment for super spread. Now, isolation, on the other hand, is you are infected and we want to remove you from other people so that you do not pass on the infection. And in isolation, you can have a group of people who are infected together, sharing a space, sharing a eating space, sharing a bathroom space or toilet space, and without the worry that they're infecting each other because they are all infected. And this is
excuse me, but does it increase perhaps the viral load in the body?
Not that we know of.
Okay.
Not that we know of. And this is the reason why you've had the discussion of possible use of boarding schools.
Yes.
There are the boarding school is. You remember we said that 80% of the people are not really needing a hospital bed, but you still need to isolate them. So that's where the story of the possible, what spaces do we have? In China, they built hospitals, right? We don't have the resources to do that. So they're using, what resources do we have that you can use to isolate people? And you are isolated. When you test negative, you're no longer infected. You need another 14 days of quarantine, and then you can move back to society. Yes. So those are the two, the two things about quarantine and
two
about
scenarios
and thingy.
Yes.
I think the other thing that we need to recognize that this coronavirus is like a war. And when you're in a war situation, it's not business as usual. As Kenyans, we have a lot of democratic space, and I think it's important we have it. But the time comes when we must follow the instructions. I'd like you to just think, we had Italy the other day, had 800 deaths.
Yes.
Then another day, 600 deaths. Over a period of 3 days, they had more than 1,500 deaths. You're having to, and when you have those many deaths, you also have equally many sick people. You're having to figure out how do you bury them. How many coffins do you build? Do you bury them in a mass grave? Do you transport to their rural villages? This is not a normal situation. So although I hear my colleagues are saying we must be involved, and I think it's important to be involved, this is a time where you also walk to the table and say, we are here, we are part of this space, and we want to contribute our bit. As opposed to saying that, come and tell us what to do. So if it's a hospital, you have a team in the hospital. All the points raised by my colleague here about how you manage an epidemic like this are correct. There's nothing stopping every hospital in Kenya putting that practice into space. We don't need to wait for the ministry to tell us to fund it. We know that we have an epidemic. Yes, and I think this is the process of empowerment, that this is our nation, this is our problem, we need to do it.
Yes.
Yeah.
Thank you. And we are talking about how Kenya as a country is medically prepared. And on set, of course, we have Professor Ruth Nduati, who is a pediatrician and also a lecturer at the School of Medicine here at the University of Nairobi. And we have George Gibore, who is the General Secretary of the Kenya Union of Clinical Officers. We will be back with more news, including that about the mask. How do you wear it? For how long should you be wearing a mask? We'll be right back.
You know, like what you're saying.
Tangu mwishoni mwa mwaka jana, homa ya virusi vya korona yaani COVID-19 imeibuka kuwa tisho kubwa la kiafya. Maambukizi ya homa hii yameenea ulimwenguni kote, wala hakuna aliye salama. Serikali kupitia idara ya afya imeweka mikakati, miongoni mwao ikiwa uchunguzi wa homa ya korona miongoni mwa wasafiri katika mipaka yake yote kote nchini.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
Inatisha kufikiri kukohoa tu kidogo kwa mazingira haya unaweza sababisha mlipuko wa homa hii usio na kifani. Ili kuzuia haya, serikali imeweka mikakati tosha kuhakikisha usalama wa Kenya wote.
The facility has all the equipments you need from handling a basic patient up to ICU setting.
Hata hivyo, wewe pia unalo jukumu katika kusaidia kuzuia kuenea kwa maambukizi.
Members of the public are encouraged to remain vigilant as the risk is still high. Let's maintain basic hand and respiratory hygiene.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
Sisi kama taifa tumepata kukumbana na changamoto nyingi na kali maishani, na kila wakati tumeibuka washindi. Hii homa ya COVID-19 hata kama inatisha, si tofauti nazo. Komesha corona. Zingatia maagizo kutoka Wizara ya Afya. Nawa mikono jinsi inavyostahili.
Tumepigwa na janga duniani, limetutetemesha kama nchi, tujitoe mhanga, tupigane na hili janga, tufunike midomo, tupigapo chafya tusanitize. Tujitoe mhanga, tupigane na hili janga, tufunike midomo, tupigapo chafya tuoshe mikono. Jamii ya kuhitaji, nchi ya kuhitaji, dunia ya kuhitaji. Jamii ya kuhitaji, nchi ya kuhitaji, dunia ya kuhitaji. Yes, sanitize, kwa muda mchache najua tutashinda.
Friends, we live in uncertain times. And that's why the government is urging all of us to protect ourselves, stay safe, social distancing, and hand washing. And please look at what the government is saying about how you should actually wash your hands. 5 times a day, 10 times a day, in fact, as many times as you can. The government is requesting that you take extraordinary measures to safeguard yourselves, to safeguard your families, to make sure that all of us work together to protect our country and our people.
KBC, in collaboration with the Kenya Institute of Curriculum Development, is broadcasting enhanced out-of-class learning on radio, television, and online. Catch the lessons every weekday